a we thing.
It's a we thing.
Once again, I'm Anna Huff Davis,
And my name is Naomi Cottons.
and we're both certified community health workers in the state of Arkansas. Today we have a special presentation. This is Oral Health Month, and we have with us a young lady, Ellen Hutchins, who is an outreach and education coordinator for the Delta Dental of Arkansas Smiles program. She resides in Little Rock, Arkansas. She's a graduate of the University of Kentucky with a master's in public health. She has worked throughout the state of Arkansas in community-based public health research and education for over 9 years, and I have had the pleasure to work with her on a couple of those research projects. She is passionate about improving health outcomes through evidence-based programs. So, Ella, welcome.
Welcome.
Thank you. I'm happy to be here.
Since this is Oral Health Month, we would like you to share with us, what does that mean? What is Oral Health Month and how did it originate? And to add on to that, we would also like to know, how can we, people like Naomi and I and other people in our communities, how can we recognize and acknowledge Oral Health Month?
Okay. So February is actually National Children's Dental Health Month. And then in June, we have another National Oral Health Month. So
Okay.
I think that alone kind of tells you how important oral health is, that we have 2 months for it, because what other, body part do we try to pay attention to for 2 months? So for National Children's Dental Health Month for February, it originated in the 1940s from the American Dental Association. At that time, it was just kind of one day, and then it progressed into a week, and now we're at a month. And so it just really tries to focus on how, cavities for kids and oral health for kids, it's a really preventative condition. Right now we have 1 in 5 kids between the ages of 2 and 5 that have had at least one cavity in their baby teeth. And it's really disproportionately affects lower income families. And with that, it kind of, there's a lot of pain that's associated with it. So they might miss more school and all those kinds of things. So it's really just an important thing for us to focus on. I think that's what this month helps us do. And then just kind of as lay people, we can do is just talking about it, the importance of it, because it's not something people generally focus on. They think, I'll just get my teeth pulled if they start causing me pain, but really we can keep them for a lifetime. And so that's what we want to strive to do, is just raise awareness, talk about it with moms and babies and kids.
Okay. Now we know that you have a program that you're working on. You want to share that program with us?
Sure. So, we've got a lot of programs that we're working on. So if anybody interested wants to work with us, reach out and I'll be happy to tell you about all the things we can do. But with community health workers in particular, I've been working for the past year basically with ARCHWA just to kind of raise awareness about the need for oral health and getting community health workers in that area. And then most recently, I've been working with Miss Naomi in Tri-County to get a proposal together so that we can have a community health worker in each region of the state to do outreach for us, particularly with pregnant women and hard to reach individuals. And again, it's really just about raising awareness about the Medicaid dental benefits. And then also navigation through the system, because it's not something that a lot of people are maybe practiced in doing, or maybe they're scared. And so I look at, even a community health worker's role might be really hand-holding at each appointment or something like that, because sometimes people need that.
Okay. We also know that there's a foundation that's connected with the work that you do or with oral health. Can you share that with us?
Yes. So the foundation, with Tri-County, we're in the works. Probably that's going to be how this project will be funded. But beyond that, we have each year they have community grants that go up to $30,000. And those open usually in the fall, and then they'll close in the winter time. And then throughout each month, we have rolling grants that are up to $2,500. And that is really for any community foundation that might just need a little bit of money and wants to promote oral health. They're pretty easy to get. You can email me for more information about it, or get my email from Miss Anna or Miss Naomi. And the foundation is really willing to work with anybody and everybody to get oral health projects up and running.
So will you share your email address with us now, even though we can still give it out?
Yep, my email is ehutchins, EHUTCHINS, and then the number 1 at deltadentalar.com.
All right. Thank you for that. I want to reflect back on when I was a child in school, and there used to be some organization that would come by and bring us toothpaste and toothbrush and some little tablets that were red that would make your teeth discolor so you could brush them. Is that something that you all do, or?
Yes. So if schools can reach out to us, or really any organization, churches, daycares, whomever, and we'll come do education. So we'll talk about whatever's age appropriate for the group we're presenting to. And we always bring goodie bags. We don't typically include those little tablets anymore, but somebody else brought those up recently. So I might look into getting them because I think they're kind of fun.
And that brought back some good memories. When I just thought about it, but it was a really good, and it's a good way to get kids' attention, I know, and also parents.
Mm-hmm. Well, I mean, and I've never used one of those tabs. I'd kind of like to use it myself to see, how I do.
Do you make presentations at parent-teacher organizations, or is it just anybody that makes the request?
Anybody that makes the request. We do. One of our big partners are Head Starts, so we do go to their parent meetings a lot, but really anybody and everybody. We are very open to all groups.
Okay. Well, I know you know that the upcoming Arkansas Community Health Worker Association Summit is right around the corner, April 24th, 25th, and 26th. And I know you're going to be there.
Yes.
And we want to encourage people in the listening audience to please come by. If you haven't registered, you can go online and register at our website. So you can actually get a chance to meet Ellen at the summit. So we really welcome you to participate.
Yes. I'm looking forward to be there.
All right. Do you have any tips for our audience in regards to oral health?
No, I think it's all things we know, which is just be to brush your teeth twice a day, 2 minutes, floss once a day, and drink water after your meals to help wash some of the food away.
Okay. All right. Naomi?
Ellen, I would like for you to talk a little bit about what poor oral health is like, what the impact of poor oral health might be for those of us in community.
Yes. So aside from kind of the more obvious ones that people might be familiar with losing teeth, there is gum disease that you can get. And the real risk with that is that it's an infection in your gums essentially, and that your mouth is a direct pathway to your bloodstream. So you can allow that infection to get into your bloodstream and affect other parts of the body. There's been some research looking at how it could be related to heart disease and cause some strain on the heart to have that level of infection. And then people with some chronic conditions like heart disease and diabetes, and then pregnancy is not a chronic condition, but pregnancy, it can lead to increased risk of those infections in your mouth. So having those things, it's really important to make sure you are taking good care of your teeth. So that way you're not kind of in this vicious cycle of having the chronic condition and getting an infection and making your condition worse.
Okay. So are there any special activities or events going on this month that we might participate in?
I don't know. So if kids haven't already started it, you can promote the Delta Dental No Cavities for Kids Challenge. It's a month-long tracking calendar for brushing and flossing. And if they turn their sheet back in at the end of the month, they do Delta Dental, then they'll be entered to win a Nintendo Switch. It's a drawing. So that's fun. And if the teachers get involved and submit the forms for the kids, if they submit like a class of forms, then the teachers can win a $500 gift card.
Oh, wow.
So you guys have an ongoing relationship with the public schools?
We do. Yep.
Okay. Very good. Okay.
So the school in my area, I don't have to worry about contacting you to get this information to the school. You already have direct contact.
Yes, it's been emailed to the schools. But if they need more information, they could go to the www.deltadentalar.com, and everything they need is right there. You can print it out.
Right.
Or we can send it to them again.
That's great.
Sounds wonderful. Well, we look forward to working with you more, learning more about your project, and trying to help as many people as we can in the state to have good oral health. We certainly thank you for coming on today and sharing, being a part of this podcast. Not many of us know a lot about oral health. We do know to brush our teeth, but that's about it. You mentioned flossing. Not a lot of us floss. Can you talk a little bit about flossing and why it's important?
Sure. So I think it's like 30% of your tooth surface doesn't get clean unless you floss. So it really helps get everything out from in between your teeth. And using a lot of people like to use those floss picks. And anything is better than nothing, but the string is the typical, like old school string is the best thing. And you just want to get it once a day, pull some of that out, wrap it around your fingers, and you go in between each tooth and make a little C motion, kind of just rocking back and forth, and then scoot it over and do the next teeth and just keep moving all around. And if that doesn't work for you, if your teeth are close together, stuff, you can talk to your dentist about other things like water picks or something like that. There are lots of options out there, but talking to your healthcare professional would be the best route to know what's best for you.
Okay. All right. Well, thank you so very much again. Thank you for coming and participating in this podcast, sharing information. And like I said, we hope to help get some information out because we want to have good oral health in Arkansas. Thank you very much, Ms. Ellen Hutchins, Delta Dental. We look forward to more to come. Happy Oral Health Month.
Yeah, thank you both.
All right. Well, Naomi,
It's the we thing.
it's a we thing.